Hello. My name is Jones, and I'm back with another lesson on minor disorders in pregnancy. This is in our series of PowerPoint integrated and reproductive health lesson. So we are going to look at some of the minor disorders in pregnancy. And to make it easier so that we follow the lesson nicely, it is important that the discomfort of the body system during pregnancy can be categorized according to systems of the body. So we have the gastrointestinal system, where some of the minor disorders that can be seen include the nausea and vomiting. Then it can be heartburn or constipation. Then under the musculoskeletal system, some of the minor disorders that are seen include a backache and muscle cramps. Then under the cardiovascular system, the minor disorders that are seen include supine hypotension, varicose veins, and edema. Under the respiratory system, some of the minor disorders include dyspnea and nasal stuffiness. Under the reproductive system, we have Leukorrhea, Braxton Hicks contractions. Okay, so then under the urinary system, we have urinary frequency and urgency, and we also have what we call stress incontinence. So under reproduction, we have Leukorrhea and Braxton Hicks contraction. So these are some of the minor disorders of pregnancy affecting the woman's body according to system. So let us now discuss nausea and vomiting under the GIT or morning sickness. One of the most common discomfort of early pregnancy is possible due to high levels of human chorionic gonadotropin (HCG) or progesterone. Okay, then also cultural expectations and emotions can cause nausea and vomiting. Other factors like hypoglycemic reaction as a result of increased basal metabolism due to the 24-hour-a-day fetal and maternal body functions, especially after a period of fasting from night to morning. Nausea and vomiting usually appear early in the first trimester, that is 6 to 8 weeks, and subsides by the end of the 12th week of pregnancy, meaning it is subsiding by the 3rd month of pregnancy. This is the most bothersome in the morning. This one is most bothersome in the morning when a woman awakes and the stomach is empty. Some pregnant women may experience this sort of discomfort at other times of the day. What are some of the nursing interventions that can be done for nausea and vomiting? How can it be managed? What are some of the nursing interventions? So it consists of advising the mother to eat a high protein snack at bedtime if it is hypoglycemic attack. Eat crackers or a piece of dry toast before getting up. That is, keep by bedside if possible. You can eat frequently spaced small meals of high quality protein foods. It will help to reduce the nausea and vomiting. Also, sipping a hot drink before arising can also help to reduce nausea and vomiting. Heartburn or pyrosis. Heartburn is a burning sensation in the epigastric and the sternal region. It results from relaxation of the cardiac sphincter and the decreased tone and mobility of smooth muscles, which is due to increased progesterone. Progesterone causes relaxing in muscles, thereby allowing for esophageal regurgitation. Decreased emptying time of the stomach and severe reverse peristalsis or severe reverse in peristalsis. So this is the diagrammatic representation. What we have there is the stomach and the irritation there. The cardiac sphincter is near the heart, so that's why you're calling it a heartburn. So it is causing the irritation at that point. What would be the nursing intervention to reduce heartburn? Nursing intervention consists of advising the client to eat frequent small meals, take sips of milk or hot tea, eat slowly, avoid fatty and gas-forming food such as beans or cabbage, maintain a good posture to give gastrointestinal tract a lot of space, not to lie down after eating or immediately after eating, not to lie down, to allow the food to be digested and to move. The best relief is obtained by sucking on an antacid tablet until the pain goes away. 1 or 2 tablets can be enough. Some of the drugs include Pep Seed AC, Zantac, and the like can also be used safely during pregnancy. Let us look at another one, constipation under the GIT, as some of the minor disorders that is seen in pregnancy. The gastrointestinal tract motility is slowed due to increased progesterone, resulting in increased reabsorption of water and drying of stool. And there will be compression of intestine by the enlarging uterus. Predisposition to constipation due to oral iron supplementation, that side effect of iron therapy, can also bring about the constipation. Some patient responds with the diarrhea. Let us now look at nursing intervention consisting of advising the patient on this issue of constipation. So some of the nursing intervention include drink at least 6 glasses of water per day, increase lavage in the diet, for example, bran, coarse ground cereals, and fresh fruits, and also vegetables with skins. Do moderate exercise every day, especially walking. And please kindly note that it is moderate exercise, and the exercise of walking is enough. Maintain a regular schedule for bowel movement. Utilize a deep breathing and relaxation technique. Under the musculoskeletal, we have supine hypotension or vena cava syndrome. Supine hypotension is caused by pressure of the gravid uterus on the ascending vena cava when the woman is in supine position, which decreases the return of blood to the heart. Symptoms include nausea, cold and clammy, feels of faint, and hypotension or hypotensive, that is decreased blood pressure. Okay, so here in our diagram we have a woman lying in a supine position, and we have the baby inside there pressing on the inferior vena cava. So when it presses on the inferior vena cava, it is affecting the retention of blood to the heart, leading to supine hypotension or vena cava syndrome. What would be the nursing intervention for this minor disorder? Nursing intervention consists of advising the patient to get up slowly, use the side lying position, preferably on the left side. Under the cardiovascular system, we also have varicose vein. Varicose vein affecting the circulatory system, varicose veins. Varicosity is an enlargement of the lumen of a vein due to thinning and stretching of its walls. It is caused by the relaxation of smooth muscle walls of veins, which is due to increased hormones, which is progesterone, which causes pelvic vessel congestion. This condition is aggravated during pregnancy due to the enlarging uterus in the pelvis causing pressure on the great abdominal veins, which interferes with return blood flow from the lower extremities. This is also aggravated by gravity and bearing down for bowel movement. This may also be a hereditary predisposing condition. Varicosity involves the veins of the lower extremities or the veins of the legs. The external genitalia, vulva or labia, the pelvis, and the perineal area may be involved in varicose vein formation. Nursing intervention consists of advising the client to avoid obesity, avoid lengthy standing or sitting, avoiding constrictive clothing. Those clothes that are very tight needs to be avoided. Avoid constipation and bearing down. Elevate legs when sitting. Get adequate rest. Perform moderate exercises. Treatment: once the varicose veins have developed, rest with legs and hips elevated. Wear support stockings before rising, getting up if varicose veins are severe. You can lie on the bed with legs extended at right angle to the body if ordered by the physician. That is promoting blood retention. If the vulva if the vulva may be relieved by pressing a pillow under the buttocks to elevate the hips, assuming the seams position for a few minutes several times a day, avoiding standing as much as possible, or laying down instead of sitting when practical. To relieve pain and swelling, take hot sea baths or local application of astringent compresses, okay, like witch hazel pads. Number 6, edema. It can be ankle edema, non-pitting to lower extremities. Edema is very common during pregnancy. It most often occurs during the second and third trimester. Edema is caused by reduced blood circulation in the lower extremity as the gravid uterus puts pressure on the larger vessels. Edema is most noticeable at the end of the day, and it is normal in pregnancy as long as it is not accompanied by the following: proteinuria. That is the presence of an excess of serum protein in urine. Proteinuria. So we're saying the presence of an excess of serum proteins in urine. So the other thing which it should not be accompanied for, so that we say now it's not minor, then there are other serious conditions, is edema of non-dependent parts. The other one can be sudden increase in weight or hypertension. So edema is most noticeable at the end of the day, and it's normal in pregnancy as long as it is not accompanied by these 4 things that we have discussed: proteinuria, okay, edema of non-dependent parts, sudden increase in weight, and hypertension. What would be the nursing intervention for edema as a minor disorder in pregnancy? So the nursing intervention consists advising the patient to maintain good posture, avoid prolonged standing or sitting, wear support stockings, avoid constrictive clothing or gaiters, knee-high shoes during a pregnancy, drink at least 8 glasses of fluid or natural diuretic that have you can drink at least 8 glasses of fluid like for natural diuretic effect. Get adequate rest and exercise. Include rest periods to elevate legs. Treatment of ankle edema. You can elevate the feet as often as possible. The edema is then going to subside. You can apply support stockings before getting up or diuretics. If your diuretics are contraindicated, you can do all these things. Okay? If condition worsens to a generalized edema, the doctor should be notified. Leukorrhea. Leukorrhea is one of those minor disorders of pregnancy affecting the reproductive system. Leukorrhea is a white or yellowish mucus discharge from the cervical canal or the vagina. It is caused by the hormonal stimulation of the cervix, which becomes hypertrophic and hyperactive, producing an abundant amount of mucus. Leukorrhea is not preventable, and the patient should not doubt. Leukorrhea may lead to pruritus, severe itching, burning on urination, foul odor from the discharge, or edema of the vulva. Kindly note that the physician should be notified immediately if any of the above symptoms, like foul smelling, are seen. It may be a sign of infection. Treatment and nursing intervention for leukorrhea consists reassuring the patient that this is normal. Tell the patient to use renew pads and to change them frequently. Also, to cleanse the vulva at least once a day with soap and water to dry thoroughly. It should be non-irritating soaps. That should be noted also. Advise the patient to maintain good hygiene. Braxton Hicks contraction. This is under the musculoskeletal system as one of the minor disorders that is seen in pregnancy. These are mild, intermittent, usually painless uterine contractions. These contractions are in the preparation for the work of labor. Treatment and nursing intervention consist of advising the patient that these are normal contractions. To get plenty of rest, it will help the patient to have reduced amount of contractions. Other nursing interventions include to change position as often as possible. So some other intervention may include to practice breathing techniques when contractions are bothersome. Then the muscles will have a lot of oxygen and become relaxed. Urinary frequency and urgency under the urinary tract are a minor disorder. Urinary frequency and urgency as a minor disorder under the urinary system. This is caused by the vascular engorgement and altered bladder function. It is caused by an increase in hormones and by the reduction of bladder capacity because of the growing fetus. So the uterus is enlarging because of the growing fetus. Kindly note that the presenting part is that part of the fetus which lies closest to the internal os of the cervix. What are some of the nursing interventions and advice in case of this condition? Okay, to limit the fluid intake before bedtime so that the patient can rest. To wear perineal pads, notify the physician if pain or burning is noted, as it can be a sign of infection. Stress incontinence as the 10th minor disorder in pregnancy under the urinary tract. This occurs later in pregnancy. The patient may actually void on herself. Stress incontinence is caused by the enlarging uterus and pressure on the presenting part on the bladder. So the nursing intervention on this may consist of teaching the mother how to do the Kegel exercises. Kegel exercises is an alternate tightening and relaxing of the muscles of the perineum, which is very important for a woman either in pregnancy or not pregnant to be doing these exercises to strengthen pelvic muscles. Encourage the mother to wear perineal pads. Inform the patient to notify the physician so that rupture of the membrane can be ruled out. Dyspnea. Dyspnea is one of those minor signs and symptoms affecting the respiratory system. Dyspnea is caused by the limited expansion of the diaphragm by the enlarging uterus that presses on the diaphragm. It may be an increased sensitivity to or compensation for slight acidosis. Okay, breathing because the woman is breathing for two. One contributing factor to the shortness of breath commonly seen among pregnant women is due to expanding abdominal content, resulting in elevation of the diaphragm and the widening or frailing of the rib cage. Dyspnea may be very troublesome in the last weeks of pregnancy. The patient may have difficulties in sleeping. Some nursing intervention for this condition include sleeping on additional pillows, maintaining good posture, avoiding overeating, stop or decreasing smoking if the woman smokes, limit activity before becoming dyspneic, decreasing anxiety by concentrating on slow, deep breaths. Dyspnea of sudden onset in patients who are known to have heart disease may be a sign of impending heart failure. The physician should be notified immediately. Nasal stiffness as one of the minor disorders affecting the respiratory system. Nasal stiffness is caused by increased vascularization due to the increase in hormone. It is not preventable. Functioning of the nasal will return to normal after delivery. Backache. Backache under the musculoskeletal system is one of those signs and symptoms. Also, is one of those minor disorders that is experienced by a pregnant woman. Backache is caused by relaxation of the sacroiliac joint, which is due to increased hormones, steroid, sex hormone, and relaxing, resulting in slight joint and muscle relaxation and increased mobility. An exaggerated lumbar and cervicothoracic caves that is caused by changes in the center of gravity from enlarging abdomen and the breast. Prevention of strain, which can cause backache, should begin early in pregnancy. So there is a strain on the spine. Okay, so muscle cramps.
Muscle cramps are caused by compression of nerves supplying the lower extremity due to the enlarging uterus. Reduced levels of diffusible serum calcium or elevation of serum phosphorus in the bloodstream. Fatigue, chilling, or tense body posture. Muscle cramps are not considered a serious condition, but they may be quite painful. Nursing intervention for this: avoid fatigue and cold legs. Eat a diet with adequate calcium or prescribed calcium. Avoid drinking too much milk per day, as too much milk will create too much phosphorus in the system. Take the prescribed vitamins B and D per doctor's or physician's instructions. Treatment during muscle cramps. The patient should lie on her back and extend the affected limb. A second individual should apply pressure on the patient's knee with one hand and sharply flex the foot with the other hand. The affected muscle may also be kneed with the heel or palm of the hand. Heat may be applied to the area of the muscle cramp. Other nursing intervention on advising the patient that the maternity girdles are no longer recommended and to practice good posture and good body mechanics. You can use pelvic tilt and bend at the knees. So that can be very useful in helping the patient. To wear appropriate, well-fitting shoes, like wearing high shoes, and also to sleep on a firm mattress or put a backboard. That backaches may indicate a kidney or bladder infection, so the patient must inform the physician of backache problems worsening. Backaches should be carefully evaluated if the woman complains of worsening backache as a problem. Danger signs in pregnancy. What would be the danger signs? We are looking at minor disorders of pregnancy, but what would be the danger sign in pregnancy? Danger signs include vaginal bleeding, edema of face or fingers, severe or continuous headache, blurred vision, abdominal pain, persistent vomiting, escape of fluid from the vagina, frequent or regular uterine contraction, pelvic pressure, dysuria, chills or fever, excessive weight gain. Okay, so there you have it. We're looking at minor disorders in pregnancy, and we have also discussed some of the danger signs in pregnancy. Our next lesson will be on antenatal care. So I thank you most sincerely for concentrating and listening to this lesson. Please, I urge you to look forward to the other lesson where I will be talking about antenatal care. Thank you.